Thank you, everyone, for coming to the Awaken Thriving podcast. Today we have with us WendyLeigh White, and she is a licensed naturopathic doctor, and she is a Hayes nutritionist and an educator. Welcome, Wendy.
Thank you. I'm happy to be here.
Yes, I'm so excited to have you. So
Awesome.
we were talking a little bit before we started recording, and there's a lot of stuff that we have to chat about.
Yeah. Yeah,
So,
absolutely.
I was hoping if we could just start off just kind of a little bit in the very beginning for a lot of people, like what is it like, or what's the difference between seeing a naturopathic doctor and like say your primary care physician or your internist? Like, what would be the difference in those two visits?
Yeah. So that's a super place to start because a lot of people aren't familiar with licensed naturopathic doctors. And part of the reason is we are licensed as physicians in like 28 or so states. And in the other states, we're licensed just or unlicensed. We're really just lay naturopaths. But in the states that we're licensed to be physicians in, we have gone to medical school, but we've gone to naturopathic medical school. We've had cadaver lab and biochemistry and pharmacology. And in addition to all of the traditional MD classes, we also take botanical medicine, homeopathy, physical medicine, hydrotherapy, which is using water to help stimulate the body. And so we're trained in the body, the physiology and the anatomy, and also the way that we can help use nature to stimulate the healing of the body. And so, in those states that we're licensed as physicians, our scope of practice varies. And so, for example, for the first 8 years of my career, I was in Connecticut. And in Connecticut, the scope of practice for naturopathic doctors is that we are not licensed to prescribe pharmaceuticals. We can't do minor surgery, and we can't deliver babies. And so in Connecticut, I was a specialist. People kept their primary care doctors, MDs, and they would see me for the natural approach, for the big picture, for acute issues that needed some natural therapies. Here in Oregon, I've been here just under 5 years. I'm licensed as a primary care doctor. So many people in Oregon, as well as Washington, Arizona, and maybe other states that I don't know of. But when we have a primary care licensure, we can act as primary care doctors. We can prescribe and manage medications. We can do minor surgery. I particularly choose not to prescribe and manage pharmaceuticals. That's just my personal preference. I like being a naturopathic specialist. I feel like I went to naturopathic school for a reason. And if I wanted to manage pharmaceuticals, I personally would have chosen to go to MD medical school. So I like being a specialist. And so my patients typically have an MD on board. Although in Connecticut, when my scope of practice was such that I didn't have to prescribe, I think I sent someone to like an urgent care for an antibiotics twice in the 8 years that I practiced there, because I believe that the human body is amazing. And I believe that through food and hydration and rest and other natural means, we can almost always help to stimulate the body to do what it needs to do.
Hmm. And so, like for a first visit, would you do like lab tests? You would do since your primary care in
Mhm.
Oregon, or even when you were in Connecticut, you can order labs and.
Yep. Yep, absolutely. So the first office visit, this is another thing that often makes us different, is my first office visits are 90 minutes long and my returns are 60 minutes. And so in that first office visit, I go over everything. And really the comment typically is, from the patients, I've never had anyone be that complete. I take a very thorough history. Like, I want to know what your mom's pregnancy was like, and what your birth was like, and what your childhood and teens and early adulthood. So all the medical history, all the social history,
Mhm.
because we are mental, emotional, and spiritual beings in physical bodies. So I want to know the big losses you had, the stressors as a child or as an adult. Um,
Yeah.
and I think it's important to really get that big picture. And so, yes, I ask for at least 5 years of past labs because I like to make a spreadsheet to see how things have been trending. And then almost always, I will then order other labs because I like to see a complete thyroid panel, and often just one or two thyroid labs are screened. I like to see vitamin D. And there are things that I consider that overall picture that MDs don't tend to order.
Do you find that vitamin D is low a lot in Oregon, or is that just
Absolutely. We get very little sun for 8 months out of the year. But honestly, it's not just Oregon, because how we make vitamin D is the sun hits the fat on the surface of our skin and converts fat into the vitamin D in your body. And
Mm,
so if someone is always washing their body with soap, they're stripping the nice protective fat that should be on the surface.
mm,
If they're using sunscreen, then the sun can't get through the sunscreen to get to that fat. Or, of course, if they're wearing protective clothing, either because they're trying not to get sunburned or because it's cold. And so most of us in this country are vitamin D deficient.
mm.
Can't speak for Southern California because I'm not there, but from the New England time I was there and from the Pacific Northwest, absolutely, we're all vitamin D deficient. And especially now, I mean, I've always paid attention to vitamin D. It's for future bone health. It plays a role in mood. People who are lower in vitamin D are more likely to have that seasonal affective disorder around this time of year. And then, of course, it plays a role in immune. And so there's been a large push towards vitamin D in this last year.
Yeah, I noticed started taking that probably a year ago. It was ironic. It was before all of this started, but
Mhm.
I noticed the mood change, and I wasn't really expecting that.
Yeah.
But there was a subtle mood change that I experienced, and I take it once a week. I take a mega dose once a week, and I
Mhm.
can't stop because of that subtle. I was like, I clearly was deficient if I
Yeah.
experienced that mood shift.
And that's so perfect that you brought that up, because the idea of I didn't even know that I was low in mood until I took it and realized the difference. And I think in general, culturally, our as an adult, we all kind of just expect to have aches, pains, to be tired, to feel run down. And I think when people work with naturopathic doctors, often they realize, like, I didn't know how bad I felt until I felt the difference. I get really upset when I hear people talking about, oh, I'm just getting old. It's like, no, no, like, don't assume that we're all just supposed to just have this last 30 years of decline, like, no, we're better designed than that.
Yeah. And I believe that too. My dad is in really good health and he's almost 80.
Hmm.
Physically, he's doing really, really well. He didn't keep up his connections, like friends wise, because a lot of people
Hmm.
pass. So that's
Yeah,
an area where he's lacking. And I can see as you get older, you need to have connection. And I'm an only child.
agree.
Not like he has like a lot of children around him or
Uh-huh.
anything.
Yeah.
But physically, he's doing pretty well. So I know that we don't just decline, but I've seen people
Hmm.
that yeah, they give into that. They're like, I'm just old, and they just
Yeah.
I don't know if they just give up, and they're just like, this is what happens.
Right. There's a great Canadian video. It's linked in my YouTube channel, but it shows really side by side the idea of aging well and struggling as you age. And it's beautiful. One of the side by side video clips is of a man who looks like he's maybe mid to late 70s, and he's adjusting his tie. And it's a split screen. And in the other side, you see the same actor,
Yeah.
but he's adjusting his oxygen tube at his neck. And the whole video, I mean, it gives me goosebumps every time I think about it, but the whole video is side by side of, you can age well. And really, that's why I do what I do. I don't want people to begin declining at age 40.
No, my God, no, it's terrible.
Yeah.
Yeah, but there's going to be a learning curve, and unfortunately,
Absolutely.
hopefully, the next generation will really take that to heart.
Yeah.
But we'll see.
Yeah.
We'll
Agreed.
move forward
Agreed.
in a positive light, right? And hopefully, the
Yes.
next generation will catch on to that and do better than our generation.
Yeah. Yeah. I'm working on a book right now, and the rough subtitle is something like how not to follow in your family's medical footprints,
Okay.
because many of us have had parents with diabetes and heart disease and all of these genetic, epigenetic, lifestyle, chronic diseases. And there's no blame. And there are choices that we can make that help minimize the development or the risk.
Yeah. And I think I was lucky growing up. I had a really stark contrast. My parents were very different. Very different. I'm surprised they got married. They did. And I was born, the only one. Um,
Ta-da!
but my dad was like super healthy, and he was like more passive and not like very confrontational. But
Mm-hmm.
my mom was not really healthy and not just she's just not a happy person.
Mm-hmm.
Everyone owed her something. She was just really bitter. And to
Mm-hmm.
see them age, wow, it was it's like a stark difference. Like it was an example to me that I didn't want to age like my mom,
Yeah. Yeah.
because that kind of attitude and just the way she treated her
Mm-hmm.
body wasn't doing her any favors. But
No.
my dad, on the other hand, was like, even though he's passive and like there was things he probably could have made better choices, he's still aging really well. He's like getting ready for a bike ride. He's like 77.
Awesome.
So he's doing well. Um,
Yeah.
and I feel like if more people had those kind of real life examples, like don't do this because
Yeah.
this is what will happen in 20 years.
Are you familiar with the ACEs study, the Adverse Childhood Events study?
No, tell me.
They looked at, and this, not that I know anything about your mom's childhood or your dad's childhood, but the ACEs study looked at, I don't remember the particular details in this moment because I didn't plan on chatting about this today, but there's like 7 criteria that they looked at with someone's childhood. And so it was safety in the home, substance abuse, emotional neglect,
Mm,
and things of that nature. And then they looked at the likelihood of chronic disease as an adult,
mm,
both cardiovascular, diabetes, and then also substance abuse, incarceration. They looked at all of these different things as adults. And they really said absolutely that your adverse childhood events really was one of the best predictors of your health as an adult.
wow, that's interesting. And looking at both my parents'
Mm-hmm.
childhood, like as much as you can, right, as a grandchild, looking at your grandparents.
Yeah.
Um,
Yeah.
I feel like my mom had some really good parents. Like I wish I had
Mhm.
her parents. And I always wondered that. I was like, how did you come from them? Like, how did this occur?
Yeah.
Um, and for me, growing up with her and him, because they obviously weren't a great match, they divorced.
Hmm.
And I felt like maybe I should have been the prime example for the aces or maybe the anomaly, because I saw that and
Sure.
ran
Yeah.
the opposite way. I'm like, oh no, I'm not going here.
And that tends to happen, right? Children of alcoholics either go one extreme and they never drink at all, or they go to the other extreme and either marry an alcoholic or become one. I mean, yeah. And anytime you look at a study like this, that's a population study,
Yeah.
it's not a guarantee. It just shows trends and it just shows the likelihood and epidemiologically increased risk.
Yeah.
But it is fascinating. To me, it says absolutely mental, emotional is connected with the physical.
Yeah, definitely. I know she had some traumas when she was younger, not really related to my family per se. And there's probably
Mhm.
things that you don't know as because children don't know
Absolutely.
everything about their parents. Good. I mean, it's a good thing that they don't.
Yeah.
So there's probably things I don't know. It's probably better off that way, but
Agreed.
interesting.
Agreed.
Interesting. All right. Let's see. So these are some questions that I know that I was looking at and we talked about a little bit, like stress and hormones. Can we talk a little bit about that?
Absolutely. And so people think of stress as only negative, like the loss of a job or not having a safe, threatening, not having a safe place to live and feeling you're in a threatening environment. But stress really can refer to anything that asks your body to respond. So, good or bad, your body can mount a response to whatever stressor it might be. And one of the hormones that is often associated with stress is cortisol. And if you think about why we would have evolved with a stress response in the first place, if there's a tiger in the corner of the room, it makes sense for my body to say, oh, danger, and send all of its energy into my muscles or into my brain so I can fight or run or scheme.
Yeah.
And so physiologically, because we are animals, if we need to make cortisol a lot, rather than that one incident that we have the incident and we recover, often many of us are living where our cortisol is elevated all the time. One of the precursors of cortisol, you can trace up the biochemical pathway to cholesterol. And cholesterol is also a precursor to our male and female hormones. So if you're always making high levels of cortisol, maybe all of those precursors are heading down towards sustaining you in stress rather than being able to head down the pathways to make your male and female hormones. So that's just one possible way where people can feel like they're hormonally imbalanced if they're chronically stressed. More of kind of a direct way. Another possibility is that many of us find that our sleep is disrupted. And not only in quantity, which a lot of people really focus on, well, I got 6 or 7 or 8 hours, but also in quality. And we need our sleep to be deep and rhythmic throughout the night. And if it's not, I think we really underestimate all that our body does while we're sleeping. For example, and I know when people say hormones, they typically mean like male and female hormones, but there are hormones that regulate hunger and satiety that are really produced and regulated while we're sleeping. So there are great studies that link lack of quality sleep with overeating the next day because our hunger and satiety hormones have been disrupted. And so if someone says that they're living in stress, and of course, look at the last year, it's important to really realize how deep that can go with affecting someone's health, that it's not superficial at all. It's not something to just like blow off and dismiss. It's really something to say, okay, like, let's look at how are you minimizing your stress? And how are you then, in the stress that you can't avoid, how are you either integrating it or releasing it so that you're not in that constant threat state, and so that you're getting quality and quantity of sleep that really helps to regulate everything else.
Yeah, definitely. I feel like, especially in the last year and before that, even certain jobs, like I feel like stress is a disease that you really see a wound in. Like there's no like, oh, this is stress. So it gets swept under the thing, the carpet. And like other stuff, like if you got injured on the job, that would be workers' comp. But you can be under so much stress and have all these body things happening to you. But it's really hard to blame it. Oh, it's on stress, because stress is such like a broad term. because it affects everyone differently as well. I experienced that at my previous job. I worked in organ donation and Western medicine. It was extremely stressful, like the most intense
Life or death.
stress like ever. Not only dealing with families, but dealing with management and other hospitals. The other hospitals were actually great. Hospital staffs like going in like wonderful,
Yeah.
but it was super stressful, and I saw the stress coming out in my body, as in like no sleep, insomnia, just like
Yeah.
it's like I was going to battle every day, and I was like, I sure am going to battle every day at work.
Right. No.
Normal.
And you're right that everyone's bodies are going to show it differently. You know, for some of us, you can just feel all the trigger points and the physical knots in our muscles because we're physically trying to like hold it together. And for other people, they don't have a problem with tension in their muscles, but yet they get an ulcer because physiologically their digestive tract is seizing up. And I think it's important to realize that we all have those different symptoms of stress. And so part of what I do is encourage people to really tune in to themselves. And I'll ask questions like, how do you know you're stressed? And, you know, for some people, they think like, well, I don't know. And I'm like, well, no, listen, like, do you feel tense? Does your belly get upset? Are your bowel movements affected? Is your mood affected? Is your sleep affected? You know, because we're all going to have different responses.
Yeah. And for me, mine was insomnia, and I would have bowel problems. Like I wouldn't go to the gym because I'd be so stressed out on, I think, like trying to defend myself, or that's what it felt like, that I just wouldn't go. And I'm like, this is all bad.
Yeah. Yeah. The physiological connection between stress and the digestive tract is if you're in that threat state, the tiger's in the corner of the room, why would your body want to waste energy on digesting, absorbing, detoxifying, or eliminating when it could put all its energy into the fighting, the running, or the scheming, right? So digestive tracts often take a hit with chronic stress.
Yeah, I could totally see that.
Yeah.
Okay, I love this. We're getting all kinds of good stuff. Let's see. Oh, this is a good one. What does nature cure mean?
Yeah. So nature cure means that because we are part of nature and not separate from it, even though we live in houses with artificial lights and artificial heat, we're still part of nature. We're still animals. That we can use the other aspects of nature to help stimulate our healing. And so in nature cure medicine, I'm just as likely to recommend barefoot walking on your front lawn as I am to recommend the kind of food that might work for your body or a nutritional supplement to correct a deficiency. So Nature Cure is using all of the aspects of nature: food, water, fresh air, grounding, whether it's gardening or sitting in the grass. There's often referring to like sanatoriums that existed in the 1800s, or a lot of European spas where people go to get healthy by eating good food, drinking good water, taking long walks, hiking, breathing fresh air. It's really aligning our physiology with the natural world, and that helps the body to stimulate itself to heal.
Interesting. I loved when I don't live that far from the beach, but I live like one city over. But I used to live like walking distance from the beach. But walking on the beach, even in the winter, with your shoes off and just your feet in the sand, there was something calming about that. And it would be cold, like it's not like I'm basking in the sun during the winter, but there was just something, I guess, grounding about being able to do that like a couple times a week.
And there are studies that actually support that physiologically your body gets itself in order when you have connection with the earth or connection with ocean air and the negative ions from that. And sure, most of us can say, oh, well, we're on vacation.
Yeah.
And so that's why I feel so good. But it's really physiologically more than that.
Yeah, it is definitely. That's where
Yeah,
I go and try to de-stress myself.
exactly. And there are different ways naturopathic doctors can practice, right? Like I mentioned that in Oregon, I could be a primary care. I could prescribe medicine and manage medications. And so not all naturopathic doctors would do kind of that nature cure medicine. We
Mm,
all learned it. It's in our philosophical foundation. And some doctors kind of retain it in practice more than others. It depends under what setting. I think if I were a naturopathic doctor working in a busy primary care clinic, it might be harder for me to take the time to explain why grounding or breathing fresh air had a physiological effect.
yeah.
Um, so some of us use it, more than others.
Hmm, okay. All right. Let's see. Oops. Okay. This is something we talked about a little bit, but I actually want to talk to you a little bit more about is what does a non-diet approach look like?
Yeah. So I like, so I've been practicing for almost 13 years now. And I was a food scientist before this. So I was in the food industry creating different food products. And so food is my thing. It's one thing that I talk about with all of my patients. And in the beginning of my practice, I did not practice with a non-diet approach. So if someone came in to me, I would put them on a therapeutic diet that often says, don't eat these and eat these. And that was the dynamic. That's very typical for nutritionists and naturopathic doctors. And then I got about 5, maybe 6 years in, and I realized how many of my patients were coming to me for a first office visit,
Mhm.
and they had so much anxiety around eating. Now, we need food. We need food, period, right? Like we need to be nourished. And eating food is not simply about macronutrients and micronutrients and biochemistry. It's also about mental, emotional, and spiritual, right? Mental, emotional, spiritual, and physical body. And so I realized that when I was seeing all these patients who were coming into me, that they may have been put on a therapeutic diet years ago. And there was no discussion about encouraging the body to heal so that that therapeutic diet wouldn't be needed forever. So I realized that, in my opinion, more harm is being done by creating these very restrictive therapeutic diets for long term when there isn't but your body is able to heal itself piece. Let's work on healing so that you don't have to adhere rigidly to a therapeutic diet. So a non-diet approach is just that. It's not saying that food doesn't have an impact on our health. It's just saying, you know what? Let's not be overly restrictive. Let's really encourage you to do a lot of connection with how do you feel when you eat this food, that food. Start paying attention. It's about practicing mindful eating or normal eating to really see the effects and then making choices based on those effects. And so when let's say someone with diabetes came into my office, or let's talk about pre-diabetes. So yes, I'm concerned about their blood sugar. However, if I tell them, don't eat refined carbohydrates, it's stressful, it's unlikely to happen, truthfully. Then they're going to feel more guilt, more shame. So guilt is, oh, I shouldn't have done that. Shame is, I'm a bad person because I did that. And really, guilt and shame tied up with food is not health promoting. And so rather than telling a pre-diabetic person, don't eat refined carbohydrates, we will talk about the physiology of blood sugar management in the body. We'll talk about cells and insulin and all of that. And we'll say, okay, two parts to this. One is, what need is being fulfilled when you eat that refined carbohydrates? Often it's an energy or comfort. Energy, we look at, are you eating enough in the day so that your body's not craving that quick energy? Comfort, we look at, okay, that's an emotional need. As we explore other ways to get that emotional need met, continue your refined carbohydrates. And when you eat that, add some protein, some fat, fiber along with it, help the physiological response be more gentle. And so it's really not the black and white, don't eat this. It's really more flexible of, here's physiology. Let's understand what's driving you to make your choices. Let's make sure we're setting you up that you are sleeping well, because we know that inadequate sleep can interfere with the hunger and satiety regulation. So really the idea, like non-diet sounds like, oh yeah, eat whatever you want, it doesn't matter. But really that's not the approach at all. It's really saying, yes, food is important, and it's just one piece of the whole entire pie of what contributes to your health. Let's explore everything and just take some of the pressure off the food.
Okay, and I like that. I know, and I've known for a really long time that sleep plays a huge role in just your recovery process, like working out, just daily stresses. Having a good
Mhm.
night's sleep plays like a vital role, and everyone needs
Absolutely.
um, varying amounts of sleep at night. But
Yeah.
sometimes when you lay down at night and you don't get a good rest, like you were in bed, your eyes were closed, but you didn't get a good night's sleep. So
Yeah.
the quality definitely helps, or definitely matters.
Yeah, absolutely.
Sleep.
Absolutely. And I think if you look at the way many of us live, again, with the artificial lights and our computers and our screens, and we're really communicating to our pineal gland in our brain that it's daytime for, like, 12, 14 hours a day. Our pineal gland, which regulates our circadian rhythm or our 24-hour clock, is getting the signal that it's daytime. And so with people who struggle with sleep, because we know it affects so much else,
Mhm.
we really talk about like prioritizing our evenings so that we're setting ourselves up to get as good of a quality of sleep, night sleep, as we can, because it is so important.
Yeah, I need to work on that with my boyfriend. He just doesn't get to sleep before midnight, and I'm like, I have
Hmm.
to go to bed. And I was trying to compromise, like going to bed at 10:30,
Hmm.
but I'm used to going to bed at 9. That's
Yeah.
my bedtime.
Hmm.
So
Yeah, we're in bed between 9 and 10, and then we're up between 6 and 7.
yes, yes. And
Yeah.
he goes to bed at 1 and has to be up at like 7. And I'm like,
Yeah.
I don't know how you're doing that. Like, I
Doesn't
don't,
add up.
not good for you.
Nope.
We'll work
Nope,
on that.
not long term anyway. And some people have a greater vitality, and vitality is just that, like, life spark and energetic oomph.
Mhm.
And some people just have greater levels of vitality, and they can go, they can kind of challenge their limits
Yeah.
for longer. But we're all human, and so eventually something's going to like catch up with each and every one of us if we continue to kind of push those boundaries.
Yeah, we're gonna have to work on that. That's 2021. Get him some.
We're all human. We all have stuff to work on.
I know I'm working on this too.
Of course. And that's, I think, another thing that comes along with my approach is there's no expectation of perfection.
Mhm.
It's about being human, not being perfect.
Yes.
And, when you think about, we are amazingly well designed.
Mhm.
Like, for the complexity that we have in our systems, the fact that more things don't go wrong more often is just astounding. And so I want people to really know that you're brilliant, right? That each and every one of us is designed so incredibly well. And if I do some things that aren't the best for me, that's okay, because my body has built in resiliency.
Yeah.
I don't have to be perfect.
Yeah.
You know, I have a liver for a reason. It likes to detoxify things that I get exposed to.
Yeah.
That's its job, but I don't want to overwhelm it, so I'm careful. You know, it's that acknowledgement that we're designed well and we'll feel better if we live within our design most often.
Yeah, definitely. I totally agree with that.
Yeah.
Let's see. And I think we kind of touched on this. We were kind of dancing around it.
Mm.
The haze. What does
Yeah.
haze mean?
Yeah, so HAES stands for Health at Every Size, and it's basically a weight neutral philosophy. And what that means is that it's not that we're saying weight doesn't matter. We're just saying that because none of us have direct control over our weight,
Mhm.
we don't focus on it. So, what we do talk about instead are habits that we have control over: food, movement, relationships, stress, chemical exposure, all of these other pieces in life that we can have direct control over and create new habits. We can focus on that. And then I always tell my patients, you know, we can make baby steps, we can make incremental habit changes and all of these other things. And then your weight's going to do what your weight's going to do. It isn't like you can really focus, like sit here and go, I'm going to lose 5 pounds. Like it doesn't work that way. But if you live according to your physiology, eat foods that work for you, find movement that feels good for you, and it might be different than your sisters or your boyfriends or your fathers. You know, we're all individuals and we have individual needs. Look at the chemical exposure and the stress management and all of the other pieces.
Mhm.
It just takes the pressure off of the weight. And another thing that Health at Every Size discusses is the fact that we are not all the same body type. If you look at the amount of padding and the distribution of padding on different people, I personally can fit, I'm trying to write it, see it in the thing. I can fit my fingers around my wrist. That tells me about my bone structure, the amount of padding that my body tends to carry. So that's my own personal amount and distribution of padding. And we know other people who are just larger bodied people. It doesn't say anything about their level of health, nor does my body say anything about my level of health.
Yeah.
And so the Health at Every Size concept just really tries to disconnect a lot of the assumptions that are made that are tied to weight.
Yeah. Because I remember like in my early 20s, I was not the epitome of health, but I was probably, gosh, 20 pounds lighter. So I was like,
Yeah.
I was really thin. I was compared to now,
Yeah.
where I feel a lot more stronger, confident, and more healthier in my body than I ever have. And I
Yeah.
am not that weight anymore.
Yeah. I am about 35 pounds heavier than I was. Granted, it was about 20 something years ago, but I was incredibly sick. And
Mhm.
and I quote looked healthy. I looked thin. I was a gymnast shortly before then, so I looked fit, and I was incredibly unhealthy. I had all sorts of food sensitivities and migraines and autoimmune stuff, and so it's just important to realize that you cannot at all tell how healthy someone is by looking at the size of their body. And our culture's terrible about this of there's study after study that says healthcare practitioners and the general public make all sorts of assumptions about the weakness and the lack of willpower and the lack of hygiene of people who live in larger bodies. And it's that narrative that Health at Every Size goes after. Like, stop making assumptions. Some people just live in larger bodies. And really, like, let's take the emphasis off the weight. We don't need to be blaming people for anything. There's no shame and blame or guilt that should be around. We don't have issues with brown-eyed people or with brown-haired people or with blonde people. And weight and padding distribution is just as genetic as hair color and eye color.
Yeah.
There's a great, again, YouTube video, although I don't think I have it on my channel. It's called Poodle Science.
Okay.
And it's done by ASDA, which is the Association for Size, Diversity, and Health, which is the nonprofit associated with the Hayes philosophy. And ASDA created this Poodle Science video. And it's basically about how we as humans are similar to dogs. You've got poodles, you've got mastiffs. And if you put a mastiff on a diet, he's never going to look like a poodle. And that's really looking at, like, some people are just larger bodied, others are smaller bodied. It doesn't have any correlation with weight.
Yeah, definitely. Because depending on what height you are, I mean, we're all totally different shapes. We carry our padding or weight in different areas.
Yep.
So to try to expect us to be the same.
Yeah. There was a great twin study that looked at identical twins and looked at fraternal twins and took pictures of them just wearing bottom underwear from behind. And you could see in the fraternal twins that the height varied, the amount of padding varied, the distribution of padding varied. But you look at the identical twins, and if someone was going to carry the padding around their midsection or around their thighs and bottom, it was consistent between the identical twins, and yet it varied so much in the fraternal. So there's a genetic piece to how padded we're going to be and where we're going to put it.
Yeah, definitely. I totally agree with that.
Yeah.
All right, let's see. This one, so what do you think about, what's the psychology of eating? What is that about?
So the psychology of eating is the idea that, and I alluded to it a little bit earlier, the fact that there's so many reasons why we might eat, whether it's an emotional need, a physical need, a societal influence, or also within the psychology of eating is the idea that we live in a food desert, and the amount of stress that it causes us to have to travel by bus or by car to somewhere else to try to get the food that we feel is nourishing to us.
Yeah.
I think so often nutritionists and naturopathic doctors, again, back to those prescribed therapeutic diets, they give them a meal plan and they say, okay, off you go. And it oversimplifies the concept of eating. It assumes that there's no barriers whatsoever, socioeconomic or cultural or just taste buds. And so the psychology of eating just really explores all of the factors, mental, emotional, spiritual, and physical, that can go into food choice. Yeah, it just takes a nod to the complexity of why we choose what we choose.
Yeah, and I can see how definitely, like, depending on what culture you are, depending on how new you are to American culture, your culture may still be eating traditional foods.
Right.
And so that's like what you normally eat.
Yeah.
And then having to change to an American therapeutic diet can seem really outrageous to some people.
Yeah. If your grandparents and parents and aunts and uncles have been eating white rice for generations, and someone tells you that you have prediabetes and you have to stop eating white rice, what's the likelihood, A, that will happen, or B, that patient will continue coming back? That's not an option for them. White rice is tied to who they are. And so as a practitioner, I think it's our job to create that space where they can say, what else can I do? That's not going to happen. And we have to be able to make accommodations for that, and not have any moral judgment of, you don't want to be healthy enough. I mean, Yeah, it's not that simple.
All right, so let's get to some fun questions. How about that? Well, one information one. I'm just curious.
Yeah.
Just curious about this. So, are there any supplements you take daily? And if you do you mind like letting us know what they are?
So this is a funny concept for me. As you can imagine, being a naturopathic doctor, particularly with the philosophy that I have that's more nature cure and more flexible and mental, emotional, spiritual, physical, it's not easy for me to find a practitioner that I trust enough to hand over my care.
Yeah.
And so I see a Chinese medicine practitioner.
Mhm.
Currently, I take Chinese herbs.
Okay.
So that's the majority of what I do for my health. I also do take vitamin D. I take magnesium.
Mhm.
Um, when I feel like it or am motivated to do it, I take fish oil the first half of my cycle and evening primrose oil the second half of my cycle,
Okay.
just to get some more good fats in there.
Okay.
And that's pretty much it. If I'm not feeling well, I might put some zinc, some elderberry, some C in there. But I kind of goes along with the nature cure perspective. I would much rather have my patients live as well as they can, minimizing stress, minimizing chemical exposures, maximizing sleep and relationships, and then really supplementation becomes just that, supplemental to life and food and sleep.
Mm.
And so, unlike many practitioners, I'm not interested in personally or recommending a handful of supplements with every meal type of um,
Well,
routines.
yeah.
Yeah. I respect and know and love dearly many practitioners who do practice that way.
Yeah.
It's just not my way.
Okay. All right. Well, I understand that. And vitamin, I take the evening primrose. I've taken that for a while. I think that's
Yeah.
really helpful for women in general.
Hmm.
All right. So on to the favorite stuff or
Yeah.
the fun questions. Okay.
Yeah.
So what is like your favorite food? What do you like
I love eating Indian food.
eating?
I always feel fabulous after, lentils and curries and vegetables. Um, I always feel great. And if I'm feeling like I'm getting a head cold, we will order Indian and we'll get it spicier than typical because I really like the spice to help like flush out some stuff.
Oh, okay. I love Indian food too. I haven't been able to find a good Indian restaurant locally around me since I moved
Oh,
though. But
bummer.
I'll look around. I'll find one. All right. Perfect. So let's see. One more. Is there any books you're reading right now that you find interesting or fascinating?
I'm reading a Brene Brown book that has something to do with imperfection in the title.
Hmm.
Um,
Okay.
the Gift of Imperfection. That's what it is. And I'm also reading Women Who Run with Wolves by a woman with three names. Her last name is Estes, like Christina Pinkerton Estes, something like that. Women Who Run with Wolves. It's all about archetypal strong women in like all the mythology and all of that. Last night, I think I read about she described comparing women to wolves and how we do well in packs, and we do well to care for each other and all of that. So those are two. I actually always have 5 to 10 books going any given time, and I fade. I have a couple poetry books. There's one that was just released that was a compilation of poets and poems that have been written during the pandemic.
Mhm.
So the title is something like poems from the pandemic, or something like that. I always have kind of like that self-help. I love Brene Brown. Kind of that realm with the science realm with usually there's a fiction in there when I just need to escape. So a little bit of everything.
Yeah, that's how I am too. I usually have 3 or 4 books in rotation. that I like to go around in. So,
Yeah.
all right. Well, thank you so much for being on, Wendy. I really appreciate it. We went
Thank you for
through
inviting me.
a ton of stuff.
We did. We put a lot in here.
Yeah, we did. I was like, and the time has flown by. So thank you again for being on. I appreciate it.
Absolutely. Thank you. This was fun. Anytime you want to chat about anything particular, you let me know.